like partially done because I'm like half paying attention. So this part's already turning brown and I haven't even put the rest in. I had some serious roots going on here. I know, it's my gloves, guys. If it sounds crunchy, it's my gloves. Cool. Want kids be trans?
Yeah. Yes.
Okay.
I was against it at first, but now that I watch you and Adora, I've been educated, and yes.
Awesome. Thank you. Appreciate that.
You're welcome.
Cool. Anything else?
No.
All right. Thank you.
Bye.
Bye. Did it freeze again? Did this stupid thing freeze, you guys? Oh my god. Shit. It's gonna be the same. I'm doing the same thing again. The cherry chocolate. The top of my hair, because my original like roots keep coming out, is much more red than the bottom. So I'm just gonna kind of keep doing the same color until I can get more of it like noticeably red, I guess. It's like a reddish brown color. Stop. Stop what? What should I stop? Stop what? All right, let's see if we can get anybody in here. Have you been lighter? No, my natural hair color is a lighter brown. So, I mean, I guess most of my life I was lighter. I tend to like my hair better darker because of my eye color. But my natural hair color is like a light brown, which is why my roots are so bad. Like I have some gray, but the fact that the rest of my hair is lighter too.
Hello?
Hello, how old are you?
33. We talked before, Mel. This is Dahlia. I don't know if you remember me. I'm sure you have a lot of people come up. But before, I had an issue with like the cis thing, like saying the cis label. And I wanted to apologize because like I've watched you over the past few weeks since we had that interaction, and I think what you're doing is great, and I fully support you, and I wish I had parents like you.
Oh, awesome. Thank you.
So that's all. All right, have a good one.
You too. Thank you. W guessed. Those of you that say nobody learns anything here, you're wrong. I am wearing very light colored shorts for this. I should have changed my freaking shorts. Now I'm like, I hope I don't get fucking dye on them. Take a shower? I'm dyeing my hair. Why would I take a shower? That's weird. How long have you been off your meds? Are you guys okay? What's happening? I'm not off my meds. Yeah, I said I was dyeing gray hair in my lighter colored roots. I am 41. 41-year-olds typically have gray hair. So I don't know if you were trying to get me on something there. What does my top say? Nobody likes a shady beach. Who waits to go live and dye their hair? Me? I mean, what do you mean? You can literally see me, right? Anyway, we have no requests right now. I have 292 of you. Nacho was eating a paper towel earlier. That's not true about 40s. Typically, people in their 40s do have gray hair of some sort. Yes, that is true. I don't know why you would say that's not true. Not everyone. Because guess what? People can be different. And also, yeah, if people love their gray hair and they're totally fine with that, that's cool too. I personally don't like having gray hair, so I dye it. Ooh, look who's here, you guys. It's your favorite person. Shit, I can't add her.
Person to hate? Is that what it was?
Yeah. Hello, Sherry.
Hi.
I don't know your name. Maka? Maka? Hello?
Hello.
There you are. Hello, how old are you?
36.
Cool. Let kids be trans.
I'm not. Are you saying that kids be trans or not let them be trans, or
Let kids be trans.
why is that?
What?
Why let kids be trans?
Some kids are trans, and those kids deserve to be supported.
Supported and sense.
What?
I was like, am I the only one who's having a hard time understanding?
I said supported in what sense?
Whatever
Any.
sense they need.
So is that like, I guess, changing the gender?
So a trans kid is not, no one changes their gender. So being trans does not mean that you're changing your gender. So children can recognize that they're a different gender than what you assumed them to be.
What then? Who assumes what to be? Who's assuming what?
You, as in like people, parents. Parents assume their kids' genders.
So
They can be wrong.
So kids are not born a gender?
No, they're born a sex, right? Your baby's born male or female, and then you just assume, like when they tell you that the baby is male, you assume that you have a boy. And in our culture, everyone goes out and buys blue shit and does a gender reveal. And no, you really don't know your kid's gender at that age. So
We don't know. We're just assuming it. And sometimes you're right. Most of the time you're right, but sometimes you're wrong. And when you're wrong and those kids tell you that you were wrong about your gender identity, or when they tell their parents that they're wrong, we need to be believing those kids.
right.
Okay, so what's the difference between gender and sex again?
Gender is your, it's social, okay, I was distracted. Gender is psychological and social. And sex is biological, so you have sex characteristics. It's what you're assigned at birth, is your sex, based on the observation of genitalia.
So like sex is male, female, gender is boy, girl.
Okay. So basically, anybody can pick their gender.
No. I
No?
literally said that you're not picking a gender. You're just developing a gender identity
And that's through society and culture, correct?
in your brain as a child.
I'm confused now. You just said that gender is society and culture.
Psychological, that's the part that's in your brain, and social.
Psychological and social. Okay, so for psychological and social, right? So aren't those two things affecting that, I guess, gender choice? Is that even a choice or no?
It's not a choice. No, it's not a choice for anyone.
You can't choose how your brain develops. It just develops a certain way that gives you a certain gender identity. What you can choose is like your gender expression. That's the social part, right? So like your clothing, your hair, the way you present, whether it be more feminine, more masculine, the social roles that you like to fall into. Those are the social parts.
And sometimes people even change things about their bodies.
Okay, so basically we're saying that it's social and psychological, correct? But you don't have a choice over it. But you do have a choice over it? Because I'm like really lost.
You have a choice over how you express your gender. You don't have a choice over what your gender is. So I am a woman. I developed that way. But I have a choice on how I express myself.
Okay, what are different examples of expressing your gender as a woman as opposed to something else?
What do you, well, that's the thing. Women can express their genders in multiple different ways.
And what are those ways?
I personally align with more feminine things, but not always.
So wouldn't that apply to everybody?
Your gender expression applies to everybody.
Like everyone's expression is completely different.
I'm not the differences in. I'm talking about the choice to express it or the lack thereof of the choice to express it a certain way. Whichever, I'm kind of confused, but I'm just trying to use the words that are given to me.
Are you actually trying to understand and you're confused, or are you just saying you're confused?
I'm trying to understand and I'm confused, so it's both.
Okay, so what is your gender identity?
Male, boy, and he.
Right, so it'd be man, right? Because you're an adult.
Yes.
Okay, so you're a cisgender man, right?
I don't know.
Cisgender men can express themselves in different ways. You can express yourself femininely, you can express yourself masculinely, you can do a combination of both, you can mix it up different days. So even if you're a man, a cisgender man, and you express yourself femininely, you're still a man.
What is a cisgender man? I don't know what that is.
You're male. You're a man who is assigned male at birth.
Where's the cis part come in? Why is the cis
That's the adjective to describe you being a man who is assigned male at birth.
It's the opposite of transgender. If you're not cisgender, you're transgender, vice versa.
If I'm a male and a man is cis at birth, then how am I a cis male? How does that make sense?
Just explain that to you. That's why I'm not sure if you're actually like trying to understand, or if you're just being disingenuous.
I'm trying to understand. You just said a male and a man and a person who expresses himself as such is a male, but then said he's a cisgender
I did
male.
not say any of that. I literally, Sherry made it very simple for you. Not transgender. Are you transgender?
I'm a man.
So are you transgender?
And you express that you're male.
I'm a male man. I'm lost at the question.
Right. So you being a male and a man means your gender identity and your sex assigned at birth align, making you cisgender.
That's the part. You're adding cis to something that already is. That's where I'm lost at. You can't say.
Literally describe things and whether or not you know the definition. I think I disagree with you here, Boom. Whether or not you know the definition, like once you learn the definition, that doesn't make it not a thing, right? So just because you've been male and man and you didn't know that you were cisgender, you were still cisgender.
How are you choosing that for me? I thought I choose that.
Nobody's choosing it for you. It's you chose. You told Mel your gender identity.
You're saying a male, I'm a male and a man, and then you're saying you're a cisgendered male. What? Man, male. I'm like, it's like you're splitting things that don't need to be split.
Oh,
do you want to start over again? Why are you making this so difficult? There's sex, which is male, female, intersex, reproductive body parts, right? The biology aspect. Then there's your gender, boy, girl, man, woman. They're not the same, right? But when you have them in alignment, having male and man, you're a cisgender man. If you're not cisgender, you're trans. It's one or the other. Are we there? Like, are you following that?
If I'm not transgender, then I'm just a regular gender. I don't get the cisgender.
There isn't a regular gender. That's the whole point of this.
How is there no regular gender if you add in cisgender and then add in another prefix of transgender? The gender is the basic.
Oh my God, stop acting like you've never heard this before and like you've never had these conversations.
I have had the conversations. The issue I have is the making up of definitions and adding of things. If the word is gender, right, and I identify with man and male, right, and you say you're transgender, and I say I'm regular gender, where does the cisgender come from?
We already explained this too.
Regular gender.
You actually didn't explain it. You just said it is what it is, and I had no choice in the cisgendering label.
We're back.
You would have no choice in that, correct?
Why would I not have a choice in that if somebody has a
You
choice?
don't have a choice in the things that describe you. You don't have a choice in the adjectives that describe you.
So if I don't,
Hold on. If it makes you feel any better, trans individuals and cis individuals did not have a choice in this. These modern day trans and cis individuals, this was actually terms that were coined over 30 years ago. So the cisgender term was coined in 1994, and you can actually trace it back further, but then you have to talk about trans and cissexual. These terms have existed for a long period of time. It has just been applied to gender, and in 1994, that is when cisgender, that specific term, was coined. But cis itself has been around for years. We've used it in chemistry. We've used it for cisatlantic and transatlantic, cislunar and translunar. Like, these all have already existed. It's just something that exists. Just like you don't, if you're an asthmatic, you do not get to pick whether that was the term you get to use. You just are an asthmatic because those are the terms that already exist. So I will be very, very clear and state I really don't give a shit if you use the term cisgender ever in your life. But that doesn't make you any less, by definition, a cisgender man. At least the way you explained it, that you were born male, you identify as a man, you would meet the definition of cisgender.
so if somebody in the inverse would say to you what you just said to me and say they don't care that you call yourself a transgender, would that be offensive?
What?
Wait, what? Sorry, no, actually, like, literally restate what you're saying. I didn't understand it.
You don't, word for word, you don't give a shit if I ever couldn't consider myself cisgender, but I am, and I have no choice in that. Now, and I said, in the flip side, if I said the same thing and just switched cisgender for transgender, would that be offensive?
For you or for me? I'm not sure. Like, I don't honestly understand your question.
It's a very simple question. You just said you don't care about what I identify as, right? So I'm asking in the flip side, if somebody
No,
said
I
the
don't
same
care. It's not an identity. It's a label.
label, whatever you want to call it. So we put label. In the flip side, if somebody said they don't care about someone labeling themselves a transgender, would that be offensive? It's a pretty simple question. It's really not complex.
If somebody wants to use the term transgender and they're transgender, go for it. If they don't want to use the term, don't use it. I really don't care. But at the end of the day, there's a definition that is going to have you as being transgender or cisgender because it has a definition that falls behind it.
Oh, there we go.
Excellent. Consequence of saying that if someone does not apply themselves the label cisgender, you don't care, and that they are still cisgender. And I said, yes. Conversely, if someone was to say they do not care that someone's calling themselves transgender, they are just a regular gender, would that be offensive?
A regular gender?
Wait, cis and trans aren't genders. That's why your statement is confusing me.
Cis and trans are not gender, so what are they now? They're just prefixes, correct?
They're prefixes. They're with definitions that go behind it.
and the gender is the suffix or the ending part that you add to these to now make a definition, correct?
What?
So wait a minute. By your literal definition, or by your literal statement, to call cisgender and transgender genders, that would mean that you think that the noun gender is a gender.
But what is gender if it's not a noun for gender?
Do you actually understand what you're saying?
I
Think so. I mean, I don't know how long you've been on here, but
asked me that. I gotta ask you that. Do you?
we literally went over the differences.
You just said the noun gender is not. Well, I don't even know what you said. It don't even make no sense.
I said that gender is not a gender.
So what is it then?
Gender is a noun that has a definition. The male sex or female sex, especially when considered with reference to social and cultural differences, rather than biological ones, or one of a range of identities that do not correspond with established ideas of male and female. So this is a noun that has a definition. It is not something that you would use as a gender. Somebody doesn't walk around and say, I'm gender.
Yeah.
We don't. You pick from the two types of gender. Well, sorry.
Pick anything. We already went over this.
Okay, so how many types of genders are there that you can pick from? Since you said it wasn't a choice.
Genders. We already talked about this. Like,
Well, wait a minute.
So then, what are the genders?
Hold on,
then?
Mel. You can't in the same. Hold on. In a sentence, you literally just said what are the types of genders that you can pick from, but you can't pick your gender. Like, you're not making any sense. That's the problem. So what are what are the genders, the labels that can apply to people through different cultural heritage, means and different societies? I believe there's 107.
There's 107 genders, right?
Yes.
And you said, and I'm gonna, because I don't want to misquote anybody. I'm very keen on listening. You said that you don't pick these genders, right?
The majority of them, I would say yes. I can't speak for every society.
I didn't ask you that. I asked, do you pick them or not? There's 107.
Again, I am in Western society. So in Western society, no, you don't pick your gender. You are your gender.
So how did these 107 genders come about if it wasn't chosen?
Different languages throughout history.
Different languages throughout history. So you're saying these genders are in different languages? Law.
Oh my God, you are actually exhausting. So if I told you that
You said 107 genders we cannot
So
pick.
if I told you that the modern term, if it would relate to current society, the word sahek, which is would be related to current society as gender nonconforming, although this is a word that comes from ancient Egypt. People aren't still using the term sahek.
What? You just said can we keep it simple? It's 107 genders that you cannot pick. Your words, not mine.
Yes, you can't pick them.
Can't pick them. So I asked, how did these 107 words come about? And you tell me the languages is what that's what you.
Yes, different societies in different languages.
Okay, so they were only different by language, not by description or adjective, by them being a certain different descriptive gender. These 107 genders are only different because of different societies and language, not because the genders themselves are different. Is that what you're saying?
I
No.
don't understand what you're saying to answer the question.
Okay. Nah, this
you have the echo.
pressing down is not. I don't think we're gonna get anywhere.
You just gotta leave and close the app and then come back. It's just a stupid glitch.
I mean, if I was echo.
There you go. If you close the app and then come back.
I was going to say, if I was going to be super specific of the 107 genders, if you actually read through them, I would say they probably narrow down because a lot of them overlap and we could condense them. But I'm not here to say that a society can't use their word for a specific gender, even though it has overlap with a different society's word.
Okay, Right.
A little better.
Hypothetical. Or,
Is it still doing it?
No, you're good.
Okay. Okay.
I was saying, is it okay if I use a hypothetical situation so that maybe we can come to some common ground of
I
understanding?
guess that we're not going to. Go ahead. Give it a shot.
Let's say you have a child that's born. By age of 2, he realizes he doesn't fit into the 107 genders. Is it going to be a 108 gender? Is that a new gender or no? He has to now fit into the 107.
A 2-year-old?
Sure, I'll take your hypothetical. I'll just use it.
So let's
I'll just
say
move. I'll just move it to. I'll just move it to a 7-year-old.
Yeah.
Because your gender identity normally solidifies around the age of 7, but we can even move it to a 10-year-old. So if somebody was to have a gender that did not fit the definition of the current definitions we have for the 107 genders, could a 108th gender appear? Absolutely.
Why would that appear if you can't choose your gender? Wouldn't he have to fall into the 107 that are previously?
Okay, I've got a question for you. I'm gonna, as long as you're okay with it, Mel, can I move it to sex really quickly? Sure. So we understood that we had males and females, although we realized that not everybody fits tightly into these neat little boxes of being male and female. And then the word intersex came out. Should that word no longer exist because it's something that we needed to create because something new was understood?
Is this a rhetorical question or a
No,
question?
this is a very serious
Okay.
question.
I don't think it should exist. No, if you're asking me, in my opinion, no.
So the word intersex should not exist, yet intersex individuals like myself do not fit into the male or female binary.
Is intersex hermaphrodite the same? And I'm just asking.
Yeah, please don't use a slur.
No, I'm asking a question for clarification.
Yeah, so the H word is an outdated terminology for what is classified as intersex, and we do not use that word.
And
Demi, he has a problem with scientific terms altogether.
I mean, that term was a scientific term. When did it not
Violation.
become a scientific term? It literally, if you know
Seriously,
the
that took
origin,
down Demi?
What?
literally, that word literally came, if you do the etymology, from Hermes and Aphrodite, male and female. That's
Okay,
where
but
you
you're
get the
still asked
intersex,
not to
right?
use it. Like, why can't you listen?
I mean, okay, but intersex, right? Same difference. We get what we're saying, right? So I'll use intersex.
Doesn't even apply to
I'll
you.
use intersex. You asked me to use intersex, right? So I'll use intersex, right? So we can move forward. So intersex individual, right?
To reset, but
I was going to say,
got it.
we're not going to have the discussion without Demi as well, because that's the kind of question that she wanted to go down. I'll let you know if I can. Okay. But I mean, my general question is, why do you have a problem with scientific terms though? Like what's wrong with vocabulary? Because I'm gonna rewind back to like when I had a drop.
Are you asking me that?
Yeah.
yeah.
Not everybody sticks solely to science, so I don't think I have
Oh, okay,
Nobody-
bye. I'm gonna reset. That was awful.
to
Okay.
respect what you're saying. I'm going
Right.
to use the word.
No, you're not, because I'm resetting.
Okay, that's cool.
Okay. I'll come back. I had a telemed appointment, but they called me and told me they're running behind. So I just have to wait till they call me and then I'm going to drop. So I don't know. Last time it took them 2 freaking hours. Remember last time my telemed appointment, it took them like 2 hours to get me in?
Oh, yeah, okay.
Yeah, I have another appointment with that doctor, and I logged in, and she called me, and she was like, "Oh, we're running behind. I'll call you when we're ready." And I was like, "Yeah," because I'm not sitting here on hold for an hour. So
Yeah, that's dumb. All right, I'll be right back. Pearl, are you chewing on something? And kitties, I need to hold my hair up. I don't have any. I think my clip is in the car. Can somebody give me the time right now? I just need to know how long to keep this shit in my hair. Okay, thank you. So it's 5:53, right? Wait, 32. Are people giving me wrong fucking times? I need a real time. A 5:33. 5:33 my time. It sounds about right, I think. 7:33 Eastern. Okay. I'm in Mountain. Yeah, so 5:33. Thank you. Okay, all the little crunching of my glove sound will stop when it'll be reduced when somebody comes in. My hair is gonna be like this for 45 minutes. So at 6 something. I don't have a clip, so this is just what my hair's gonna look like. Yeah, that looks pretty good. All right, I'm gonna sit, I think, at my desk. Thanks, Boom. Looks kind of something. All right, let me move this over here. Why are you dyeing your hair on live? I do this like every 6 weeks, so that kind of just shows that you aren't here very much, which is fine. You don't have to be.
I was gonna say it's not against the rules to I don't know, or people will hassle you about putting on makeup in your lives when so many people do it. It's ridiculous. It's called multitasking, people.
Seriously, I am by far not the only person who does makeup on live. Actually, I'm not the first person who did it. I won't be the last person.
Right.
A lot of people cook on live. They do all kinds of shit while they're here. Like, why not?
And Mel is well aware that people will take screenshots of her hair like this. She doesn't give a fuck. It doesn't matter. It doesn't matter.
People have screenshots of me doing all kinds of shit now. I don't know anymore.
It's funny because I think it bothered you for like the first 5 minutes when you very first went live. And then after that, you're like, I don't give a shit.
No, I don't care. Look at me.
Hi, Greg.
I look wonderful. Also, I think the camera, I look bigger than what I am like this. So everybody's like, oh, Mel, you're so fat. I'm like, whatever.
You're not.
Hello. Hi, how old are you?
So you're saying that
What's your age?
I'm 18.
What year were you born?
05.
All right, go ahead.
Okay, so you say that we should let kids be trans, right?
Yep.
If they are trans, sure.
Okay, but how come we don't let them get tattoos at a kid age?
I had no idea you were going to say that.
Oh.
Huh?
I had no idea you were going to say that.
Why
it's
can't
because
they buy
tattoos are not medical
cigarettes or
care.
alcohol?
Oh, never heard that before.
No, I just want to hear what you have to say about
That's
it.
why.
It's not medical care.
It is willful body changing.
What? Willful body changing?
Yeah, they're mutilating their own bodies at such a young age. Well,
Heaven.
we don't allow tattoos or
Tattoo is
alcohol.
mutilation now?
I know.
Of course.
It's funny the words that they like to use and the the dramatic vocabulary. First of all, I'm going to inform you of this. Kids aren't doing anything by themselves. What happens is after years of therapy and recommendations by an endocrinologist, they might get prescribed hormone replacement therapy, which can make some changes to their body, but they aren't doing it themselves, and it's not mutilation.
Which is disgusting, and those enabling it should be put behind bars.
Okay, the whole medical community, you want to put the whole medical community behind bars. That's what you're saying.
The people who allow these kids, who allow these kids to take hormone altering.
Yeah, so
substances.
that's like the Endocrine Society, the American Academy of Pediatrics.
the American
They give those
Psychological
to
Association.
someone who isn't, like, for example, a boy who isn't experiencing puberty. Yeah, sure, you can give him testosterone boosters, but a girl who says she's a boy, that's disgusting.
I think what you're saying is disgusting. So, I mean, what does that mean?
Yeah, and you are so misinformed on the shit you're saying right now.
Well, why are we letting these kids choose, make these
We're not.
big decisions?
Because that's not what's happening.
So someone else is choosing for them?
No, their gender identity is developing incongruent from their sex, and if it does, they deserve whatever type of care and support that they need.
Well, gender identity is a mental disorder, so maybe they should be treated for that.
Gender identity is a mental
Gender
disorder,
identity?
Yeah, if you think you're the opposite gender, then yeah.
but it's not.
That's
Okay.
true. Okay.
It is.
I love it when 18-year-olds come in here thinking they fucking know everything. It cracks me up.
I can't. Like, gender identity is a mental disorder. Like, so what? Everyone with a gender identity has a mental disorder?
I mean,
So everyone, even if you don't, or you have a gender identity.
I think also in the DSM, correct me if I'm wrong, I believe erectile dysfunction is also in there. So is that also a mental illness?
This is
I'm
just
just putting it out there, you know.
So, I got a question.
Oh, how old are you?
I'm 32. Definitely not a fucking kid or anything like that. But I got a question for you guys. Say,
Fantastic.
100 years from now, all of you transgenders are buried in the ground.
God,
And
fucking
then an
hell.
archaeologist comes along. What's he gonna say you
gives a
are? Is he
shit?
gonna identify
I've
you as
never
the
heard that one
107
before
fucking
either.
fucked up things that you guys
We
think?
need to start playing
And that you're
Bigot
trying to
Bingo
push
again.
on other
I
people? Why are you
know.
pushing this shit? And why would you push this shit on kids?
We're gonna bring
It's
back Bigot
disgusting.
Bingo now. I don't care what anybody says. We're gonna make up new bingo cards on a Friday night. I'm gonna get some adult beverages and we're gonna play Bigot Bingo again because this shit is why it's like recycling. Like it's like starting all over again.
It
They
is
throw
like
out-
the Bones argument went
Yes.
away for a while, and now it's back. It's like,
and they like we've never heard it before. Or like kids can't get tattoos. They can't drink alcohol. Why should they be able to? Like we need to bring it back. I'm sorry.
oh, for real.
God, I'm getting a headache now.
Oh no.
Ugh, thought my
Hello.
coffee would help.
Hi, how old are you?
Hi. I'm 18. I'm born in 2005, September, to be more precise, and I'm transgender.
Okay.
Actually, transsexual. I'm gonna say how it is. Look, I don't agree that kids should be trans.
Oh,
You're literally 18, so were you not trans last year?
Well, I wasn't medically transitioning.
That's not what we're
I
talking about.
Look, I agree that kids should be allowed to like publicly transition, like change their clothes, hairstyle, and stuff like that, but not like go on hormones, blockers, anything like that.
why?
Because that stuff is irreversible. You cannot reverse that.
That's
That
not
was
true.
cute.
It's
That's
very true. What do you mean it's not true? You know they give like puberty blockers to like pedophiles so they can castrate them.
Yeah, yeah.
You're aware.
Be careful with the
Okay.
language on
Extremely
here.
high doses and extremely high doses, and it still doesn't even work. You do realize, Jen, that
That's
lots
not
of medications. But Jen, do you realize that lots of medications are used for multiple different things?
Yeah,
some
but if you don't need it for a good reason, it's
Yeah,
not
if you
good.
take too many depressants, you can unalive, right?
Yeah,
Right.
that's
Or if you
if you
can
mix
have
it with alcohol.
seizures, right? You can have seizures or hallucinations. Uh-huh.
Yeah,
Yeah, that's why you
Okay.
shouldn't take too much, right?
but
So you're not giving
still,
high doses of puberty blockers. You're giving them a pediatric dose. So it's not
so
even
you shouldn't take it. It's not like they need it. They're kids.
But Jen, you're not
Let
a doctor. You're not qualified to say that.
Are you? You're a cis
No, I'm
woman.
not.
You're a cis woman. Exactly. You're
Yeah,
not
with a
even like.
trans
Do you have
kid,
trans
Jen,
kids?
who's on HRT. Exactly, Jen, with a trans kid who's on HRT and has been on blockers. And
How old are they? How old are
I've
they?
met with a top endocrinologist in the country. I got educated for years on this before my kid ever started treatment, and it's up to me, my kid, and my kid's doctor. Like, if
Okay.
that wasn't right for you,
How old
that's
is your
fine.
kid?
You have
How old is
no
your kid?
place telling people he's 16. You have no place telling
Okay.
people that they shouldn't be able to get the same care that you're getting right now. That's ridiculous.
Look, if your kid is fully like 100% sure, then whatever. But there's
Yes.
kids that they don't have that like type of resources to like go and like figure that out. Like they
But
might
Jen, we're not
know.
saying, but we're
If
not saying
they
that
don't
the kid
have
is
that type of
unsure.
resources, then they don't get it.
Right.
Oh my God, you're so evil. Oh my God, what?
What?
Be for real. We're not being
You're,
evil. Let's not
of
even.
course you are. You want kids to be
We
trans,
literally
like
were not
what?
advocating for any child to get any type of medical care that they don't need. That
Yeah, but still you cannot be 100% sure that someone is trans. Like me
so
before when
how
I was like,
are you not 100% sure about yourself?
no, I am. Now I am. But when I was really like
So when
young,
you were
like
17, you
14,
weren't 100% sure, but now you are 18?
yeah, of course, because it takes time to fucking
Eddie.
process
Well,
that.
that's you, Jen. That's you. My
But
kid
that's
has been
everyone.
sure
That's
for
everyone. Kids cannot
years.
make such deep decisions.
Well, they do. If
Okay,
it works to cure their gender dysphoria, Jen, then why not allow them to do it?
look, one day maybe your kid comes home and says, "Oh, Mom, look, I don't feel trans anymore." Like, what are you gonna do?
I've talked to him about that. You know, of course, you don't think we have these discussions with our kids. I've
Obviously, you
talked to him about
should.
that. Right, and I have talked to him about that. Even before he started HRT, we had so many discussions about this, and I was like, is this the absolute right time for you to start it? Should you start it in a year? Should you do this? We talked about every single possible thing that could happen. I told him, what if you come to me when you're 25 and you say, you know what? This wasn't the right thing for me. He's like, well, then I would just want you to support me wherever I am and what I need. He's like, but I know exactly what I'm doing. This is going to help with my symptoms. So I would appreciate you supporting me in it. That's it.
Look, for males, it's a little like for transgender men, it's more different than transgender women. So like I'll say that, but like for men, like transgender men, it's harder to reverse that because your voice actually goes down. You get a lot of facial hair and like you actually just like square out and you could lose your reproductive like
He's aware of that, huh? I know that. He's totally aware of that. He's been on HRT for a year and 5 months now. Yes, he like has half of a beard now. His voice is completely dropped. It has affirmed him in every single way. And like his quality of life has greatly improved. Like I've told Mel, I had a kid who freshman year in high school didn't want to go to school. He wanted to drop out. He would beg me to drop out of high school. Finally, after starting the HRT, he started becoming more social in school. He started joining groups, started joining sports. Now, as a junior, he's actually trying to do the classes he needs so that he can actually go to college. Like, he sees a future in his life where a couple years ago he didn't.
see,
Like,
that's
it's
really good. That's really good. That's how I felt too before I started my transition at 16, but
right.
like not medical transition, only like face like appearance wise.
Okay.
And
But every kid is different, Jen. Some
of
kids,
course, that's the
some kids
thing. And like a lot of kids can't like they can't decide when they're young. They might feel like they're wrong, like, but it's just puberty.
Yeah. So, Jen, we advocate for them to go to the proper guidelines, to go through therapy, to go through to get support letters, right? Only
Yeah.
2.5% of trans kids or trans identifying kids actually end up on puberty blockers.
Yeah, and a lot of them grow out too. They
2.5%.
Yeah, and a lot of them grow out of being trans too.
no,
And
not
you know,
the ones that have started treatment.
Doesn't mean
Not the
look,
ones that have
trans.
medical
your
treatment.
background, I know what you're doing here. I think you're provocating people with your background saying let kids be trans.
I'm doing what now?
You're provocating people. You know what you're doing.
What do you mean I know what I'm doing? Yeah, I know that the topic gets attention. Is that what you mean?
Obviously.
Yeah, that's how TikTok works.
So are you against kids like medically transitioning or not? Like
No,
what?
nope.
No, Jen, we both have trans teenagers who are on HRT. We're here to support them, right? And all trans kids and the parents of trans kids who don't know what to do, right? This is like this has just been, presented to them, and it's like, I don't know how to support my kid. I don't know what this means. I don't know what to do, right? So we're here to offer some insight into that. And then we have friends who have a lot of expertise in this area, just from different angles. And we're here to answer questions and educate people.
All right, but like, okay, well, I guess I see your point, but y'all shouldn't be like being this like, let kids be trans. Like, leave the kids alone. You shouldn't be like pushing this down people's throat. You should just
We're
be
not
like,
pushing anything down anybody's throat. Like,
bitch, yes you are, ho. Fuck you mean, ho. Look at your fucking background, ho. Don't fucking play with me right now.
You
Are
okay?
you for real?
She just starts calling me a hoe?
Yeah. Yes, so.
What? I get what you're doing,
Yeah.
but you're a hoe.
You muted me.
I find it interesting that Jen was like, "Oh, you're provoking, Mel," but then calls you a hoe. Provoking.
Okay, what are you, Aaron?
I'm a
Don't play
cisgendered
with me.
man.
Oh, okay.
So what?
Do you have any trans kids?
I work with kids who are trans or gender diverse.
Yeah, and how's that going?
Going really good.
Mm-hmm. Do you like, what exactly are you like a?
Mel,
Therapist.
hold on, everyone pause. This person is absolutely a child. If you're gonna talk like that and has a Roblox link in your bio, this person's a child.
The bitch, I'm 18 years old. What do you mean?
You're a child. Get out.
I don't mind.
I'm literally 18 years old.
You
What do
are
mean?
a child. You have a Roblox
Oh
link
my
in your
God,
bio,
you actually
and
would- oh my
and you are talking like that.
I don't care. It's fine. It was weird to just start calling me a hoe.
Roblox is a game for children. Anyway, I'm gonna hop back down.
Thanks, Boom. How's it going, Aaron?
That was weird. Like, let's.
Go ahead. Just
Like-
sorry, Mel. Go ahead.
I'm just still trying to process that. I'm sorry. It was just strange. Like, oh, I understand what you're saying, yo.
No.
Anyway, Ted.
I just want to say, all right, they're your kids, whatever. That's
Wait,
fine.
we
You
need
do
to-
what you want.
Ted.
But I think
Ted?
kids should wait till at least
Ted,
they're
God damn
18.
it! I need your age, please.
My age,
Yes.
I'm 40. I'm 43.
Okay, great.
Awesome.
So
Go ahead.
my sister's gay, and no, just listen. Hear me out.
Your sister is
I don't-
gay. I don't care if your dog.
No, I'm
is
just
gay.
trying to explain.
Fuck.
And she agrees with me full-heartedly.
Yeah,
One
Kid-
people who's not the spokesperson for trans care.
Kids should not be forced to do anything. They should not be really talked to. You wait till they're old enough to
They
let them
should
make
be
their own
talked
decision and come to you.
Wait.
Yes,
No.
they should
This
come
is
to you.
so weird, Ted.
Can I-
Ted, this is so weird.
Let's just not
So you
talk to
think-
kids.
So you think, Ted, that my trans child who would come to me and express all of the things that would make him feel dysphoric, all of the things that were giving him anxiety, depression, all the things that he was having a problem with, and he comes and he tells me, you think that somehow I'm forcing him to get care for those things?
Well, by indulging all of this and telling them that it's normal to feel that way, and that,
is.
yeah,
It is normal.
maybe it's an underlining issue and you're
Ted,
just
it is
covering it
not
up.
normal to be
Years of
trans,
therapy.
Ted.
It is not normal, lady.
That is. It is.
It is not normal.
It
You
is.
are what
Explain.
you're born with.
May I?
Simple as that.
Uh-huh.
If you have a penis, there you go. You're a man.
No,
Simple as that.
It's
You
not.
can't decide.
It's
what
not
you
as
wanted.
simple as that.
Ted, I have a question for you, if you don't mind.
I'll smile.
Go ahead.
So when I was born, and let's say I was 2 years old, does that the fact that I have a penis make me a man?
No, it makes you a boy.
Right. So it would be
And boys
inaccurate
grow
to
to
say that's right. So gender changes over time in terms of representation of its development. Now, during that arc of development, there are some kids who have very clinically significant issues with their development that need clinical attention, such as therapy or even endocrinology issues. So when I, as a therapist, work with kids that might be going through those issues, affirmations are part of that care, but that's not indulgence of it. That is supporting the child and trying to help them work through stuff. So there's no indulgence there.
But nobody should be put on puberty blockers or anything like that at that age. You're not really giving them a chance to decide.
I've worked on cases where I've had to work with their endocrinologist and support them during that process. So when kids are on the puberty blocker, it's not a choice that the child makes. That's basically the recommended medical care based on the extenuating symptomologies and the presentations of behaviors. And so when I work with those kids, we're not just putting them on puberty blockers recklessly. We are very, very thorough and very cautious at the same time.
So it's not your natural genetic makeup to stop that kind of thing. So
Correct.
if you're a man, you go through puberty. Why put them on puberty blockers? Why not wait till they're an adult to make a...
Men don't go through puberty. We said boys do, right? Because men is about being adults. So you have to go through adolescence before you get to adulthood.
Yeah.
So
So
when
my
we're
point
talking
is,
about-
why
when we're
put them on
talking-
any kind of puberty blockers?
Right,
Why not?
so that's
Do you
a great
actually
question.
want the answer of that, Ted?
Yeah, I was about to give you the answer, Ted. So the reason for putting them on puberty blockers is either to see, or if there's various other significant circumstances, to stop the puberty from causing more distress.
So
And
their
so we-
natural makeup, you want to suppress that.
No,
Yes,
we're not
we-
suppressing their makeup. We're suppressing some developmental markers that are causing some distress. And that
So-
can happen.
Sometimes.
But
It's
by,
very rare.
Very rare.
by
Yeah.
blocking development, you're not actually letting the natural flow of things.
So when they are having issues where the development is causing significant distress, we stop that. It's no
Like what?
different. It's no different than any significant development of a disease, and we stop the development of the disease.
Okay, but this isn't a disease.
If the puberty itself is causing discordance with, let's say, their image, their sense of self, their self-esteem, if it's causing them dysfunction in the family, dysfunction in the school, dysfunction in other social areas, we pause that development to see what happens, excuse me, when those things are stopped and the person is able to function without those changes. And if for example, they go on the blocker and the pausing of puberty may only cause some reduction in distress, but then there remains a lot of other stuff, they would go off the blockers and go through a different treatment program.
Yeah, so you guys should just let it happen naturally. If they still feel that after puberty, then they feel
This
that
is
way.
the problem, Ted. This is the problem,
But a
Ted.
lot of hormones happen through puberty.
Ted.
Therefore,
Ted.
no.
So Ted, can I just? My patience is really wearing thin. The problem is, Ted.
I don't care.
For the kids, I don't give a fuck either. So for the kids who really need these medications, right, the blockers and HRT, if we just allow them to go through their biological puberty, it can cause such a high level of distress that it could interfere with the child actually being alive. Like this is not a joke. It's not something you could just say, we're going to make you go through the wrong puberty and we're going to deal with it later. For some kids, this is life or death. And so we have to take those things seriously, Ted. And we don't just hurt children and make them go through the wrong puberty when we could prevent that.
Yes.
So
to
actually-
we have to do a lot of risk assessment and whether or not preventing the puberty would cause a lot of issues. So it's about assessing for specific risk factors. And if there are, for example, no risk factors with going through puberty, but the child insists upon going through like a puberty blocker, we're probably going to say no. We're going to figure out what else is causing the distress first, and then figure out what's the best course of action afterwards.
So just my view on it is you let them go through puberty, but if you're worried about them being unalived by it, get them the counseling to work through it.
They're doing counseling
Therapy-
the whole time, Ted. They're doing
Yeah,
counseling the whole time for years. It is the
Yeah.
counselor, along with the doctor, who is recommending the treatment, Ted. You cannot take a kid to a therapist and the therapist make them untrans. You can't take a kid to therapy and make trans identities go
Yes.
away. It doesn't
So
work
in
like that.
The only reality with trans is if you're born with both parts. That's the only time it should be modified.
No, that doesn't even
Sorry about it. It's called transvestite for a reason.
No.
What? That's a slur for
Yes.
one thing, and that makes zero fucking sense.
That's
Wait,
the only time trans
Can I explain?
really
Can I
exists.
explain?
book.
So
Go
Ted.
read a book.
So Ted, like,
Go read a book.
Since you're
Well,
gonna listen to a man, Ted, we will let Aaron talk again.
oh, I appreciate it. No, I'm just kidding. No, so so Ted, like when we're talking about the differences in words use, transvestic and transgender are vastly different, especially in the clinical realms. Transvestic refers to sexual behaviors which kids don't have, and transgender refers to normal developmental patterns in brain function, which is gender
so it is a
development.
mental issue.
No, let me finish what I'm
Yeah.
saying before you get all horny about it. Okay, so what's happening is people experience incongruence in some rare cases. That's not a mental issue. That's just a variation of human development. The mental health issue comes into play when, for example, a person's incongruence causes some distress along the way. That's the mental health issue, because then they are losing function in daily practice and or losing social relationships, or they have a very lessening of their self-esteem. That's the mental health issue part. The fact of a child being trans is not the mental health issue. Just like the fact of a kid having any identity within the human experience is not a mental health issue automatically. And that's how I distinguish in diagnostic terms when a child is trans and or when they are gender dysphoric, because not all transgender kids are gender dysphoric. Some, in fact, are just euphoric, which is the opposite of dysphoric.
Yeah, it's still a mental issue. I'm sorry.
Oh my God, Ted.
It is.
Yeah, tell that to the
You are-
therapist.
you're-
Peg,
what you're
we know
born with-
everything.
What you're born with,
It
what you
is who
are.
you are. Yeah, actually. I'm not arguing that, Ted. Not arguing that.
Yeah, I'm just curious,
Well,
Ted.
because you can't.
So, Ted, what kind of denial are you coming from?
Well, me being raised how I was, you are what you're born with. If you have a penis, if you have the chromosomes as a male, then you're a male. At that point, you're not going to, because what you're born with is what you are. You can't just magically change your identity.
No one is saying that we do. That's why incongruence is a developmental pattern where no one changes their identity. It's just simply is a variation of that development. It's not changing
Well, then
anything.
you should let it just happen naturally, and if they still feel that way when they're adult, then they have the
trans
choice to do it their own way.
Most trans kids don't need any intervention. They're just fine as they are in their incongruence. It's just those who have distress that where they need extra help. Hence why there are interventions in that case.
Right, we don't just leave kids that are like suffering with symptoms alone. Like, oh, you have to deal with that on your own. No.
No, but that's good that you talk to them about it. But
Get them
I
to-
wouldn't do any kind of puberty blockers or anything like that. I'd let it happen naturally. And if they're
Ted,
still feeling
Ted, you're
discomfort
not fucking
after the
listening,
puberty,
dude. No.
no, because it's not natural.
It is
Puberty
natural.
blockers are not natural. It is a
Well,
medical thing.
neither are your Motrins, or neither is Viagra for that matter, or neither are a lot of medications for it. So
What?
you have to be very careful with this sort of lingo in terms of things are being natural. It doesn't really matter. We don't sit there and say stupid things like chemotherapy isn't natural, so we shouldn't give it. We give it because it addresses really bad stuff.
Or my allergy
Yeah.
medication.
So let them go through the puberty and see how it works out.
The puberty
part
a lot
of
of times
therapy-
is what's causing the distress. If puberty is causing distress, why are you allowing that to make the child worse?
Yes. So that would be
It's not
what's called a
making it
maladaptive. That would be a maladaptive
It
coping
makes it
No,
mechanism.
it is not. Everybody goes through puberty.
Oh my God. You have no
So-
understanding.
So why suppress it?
Why is it what?
Everybody goes through puberty, male and
Actually,
female. Why
not
suppress it?
everyone, So actually, not
already told
everyone.
you why.
Not everyone does. Actually, there are some very rare cases where people don't go through puberty and it causes issues. So they need the opposite, which is hormone replacement therapy.
So how do you really know that it's not a late puberty? Because I know somebody who went through puberty at the age of 16.
Because if they're not in puberty, they can't go on puberty blockers. Ted.
Yeah, so basically so puberty happens in stages, Ted. When those
Right.
stages happen, you can see visual changes, and so some people don't go through those changes and they need help to get those things. Just like
But how do
kids
you know
who
it's just not a late bloomer?
Okay,
Bro.
do you not understand the language I'm using? Because I'm saying exactly the
Yeah,
same
I am.
thing.
It just
Okay,
doesn't make
then I don't
sense
know why- I don't
because
know why you're being
not
contrary.
listening, Ted. It's not making
Yeah.
sense because you're not listening.
no, I'm listening.
Being contrarian isn't helping your case here. But I'm going to also mention the opposite is true. Like, say, for example, a person has a late onset puberty or doesn't have a puberty at all and needs help with it. The opposite is also true, where another person, like a child, has a very early onset of puberty and needs help stopping the puberty until it's physically appropriate for them. So we have all these ranges of applications for endocrine issues related to puberty development. The same is applied to children who are experiencing severe symptoms of distress, and they get a diagnosis for it and they need help with it. The point here is all these aspects were just helping a child. They're not hindering a child. If there are things specifically that hinder a child, we don't do them, especially for that significant or that individual child. Like, there are kids who have dysphoria and they may be, for example, recommended for blockers. They go to an endocrinologist. That endocrinologist does a thorough assessment and says, wait a minute, no, we can't do this because this kid has a severe bone issue or something. So the point isn't to make generalizations, it's that we do things very step by step.
I understand all that. I get that.
Yeah, so you're
Okay. But-
you're advocating to harm children, not help them.
Right. And let me add one more piece to that, Ted, before my stupid doctor called to say they'll be ready in 10 minutes. So I got a couple minutes. So let me add another thing to this. When we don't allow kids to have puberty blockers, trans kids who have gender dysphoria, and it has been recommended that they start puberty blockers, later on in life, it tends to give them more medical procedures and more difficult medical procedures that they need to go through in order to relieve the dysphoria. So, like,
Yes.
for instance, with my son, his dad had the same viewpoint as let's make him go through the puberty and this will go away. No, he went through a year of puberty. It got worse to the point where he was abusing substances to self-medicate himself. He was thinking about self-unaliving because every day that his body was feminizing, it was the end of the world for this child. And so when he was finally able to start blockers, he had so many changes that now he's going to require top surgery, where it could have been prevented if he was able to start the medication when it was recommended. So now he has an added surgery.
Yeah, okay. That's all I got. I'm just not feeling it. I feel like I said, the trans.
You just want to
it's a
keep
medical
harming
thing.
kids. Cool, Ted.
I know, Ted, you're an embarrassment to Gen X, honestly. You sound like a fucking boomer, and it's really upsetting. I don't like it. Please
It's
don't
almost-
embarrass us.
can
You
you-
can learn.
I'm finding it funny to imagine someone going like, learning about, for example, a cancer patient gets like a puberty blocker, and that person's like, yeah, I just don't believe it. Like,
It's
so what?
wild to me. Like when we give, especially when you give, like a lot of times a lot of these people that resist, like they like anecdotal stories too. So that's why we try to give both, right? Like we try to give like actual education, and then sometimes did Mel put her honey in her hair? No, I dyed my hair. I gotta rinse it out. Honey. That's funny.
You can dye your hair with honey? I've been drinking all that
Anyway,
honey.
so that's why we try to give both. But especially when we give like heartbreaking and anecdotal experiences, and they're like, "Meh, I don't care."
And it's always I don't feel it. Well, it's not about your feelings, Jan.
Yeah, and when you come in and like, my gay sister agrees with me.
Oh, good.
Fuck care. I don't care. What the fuck? Wow, your gay sister has no understanding of what being trans is. I'm shocked. Yeah, I'm gonna rinse my hair in a second. Let's see.
I did take note that if I explained something to him, he would say I would understand it and then turn it on against you.
It's
I'm like,
wild.
oh.
Hello.
I've never
Question.
noticed misogyny before, though, so that must have been a new thing.
Question: Are we saying that you should let your kids be trans, or that you should protect them from being so?
What's your age, real quick?
38.
Thank you. That's all.
You
Protection.
cannot protect your kids from being trans. Either your kids are trans or they are not trans.
Okay, honest question. Do you really think that kids under like what age limit are you talking? Like
5
How
to
long have
17.
you been here, Vanilla?
newly? I just now came across the live, honestly.
Okay, I don't know how I managed to pick the new person. All right, have fun with this, guys. I'm gonna rinse my
Yeah,
ears.
5 to 17 years of age is generally the age range that Mel's talking about. So that's because that age range is representative of the development of a person's gender, including trans kids.
Right, but do you really think that a kid under 13, 14 years old is mentally capable enough to make a decision that's going to affect them for
Some
the
can.
rest of their life?
Some can.
Vanilla.
Now, I will say I have nothing against gays or trans or anything, but I just think that under like the 15, 16-year-old, like they're still babies. They don't really know what's going to be good
So,
for them. in the long
Vanilla, a question for you. I don't know. Are you a man? I'm
Yes.
Guess. Okay, cool. When did you know that you were a boy? How old were you when you knew you were a boy?
I was young when I knew I was a boy.
Give me a guess. Give me a number guess.
I mean, look, as soon as you can walk, right, you know what you are.
Right.
I understand what you're saying.
Yes, walking
There we
is
go.
within the first year.
Right.
But the science of gender development.
If I were gay, I don't think that I would have been able to mentally make a decision for myself at that young of an age.
Well, sexuality isn't a decision either. Like we just kind of so think of gender and sexuality as emerging properties of humans that have no choice in it. They're just emerging. There's no influence per se on those things. There is influence on how you express it or talk about it, but those are just emerging properties of human development. So, for example, language is also or basically accent is how like a person talks. It's an emerging property. Other things are also emerging properties, like walking, or thinking, or using rational thought, or thinking about patterns. And so, gender is still part of that big stratosphere of a person's development at age 5 and up. It just takes a while.
I'm gonna go do my doctor's appointment. I'll be right back, guys.
Bye, Sherry.
And say if one of mine, I have a 2-year-old, I have a 4-year-old. If they decided, hey, I'm gay, whatever. Okay, hey, look, be that, cool.
Vanilla, I want to stop.
But
Sorry to interrupt
my
you.
son is my son. My daughter's my daughter, right?
No,
if
no,
they get into like middle school and my son's like, hey, I want to start dressing as a girl, not gonna happen, bro.
Vanilla, hold on. You keep saying if my kids said they were gay, we're talking about right now gender identity, not being gay, not sexual orientation or sexuality. It's not the same thing. Okay.
It's literally the same thing, though.
No,
that's not. No, that's not at all.
Oh, that's how we can demonstrate it.
A guy can identify as a woman and not be gay.
Vanilla, hang on, man. Bish and I are going to talk about something.
Thank you.
Bish, are you and I both men?
We are.
So we're both men.
Yep.
What's your sexuality?
I am gay, and you?
I'm straight. Oh shit! So they're not
You're
the same
cool.
thing.
Right.
Oh, dang. Okay.
But we are the same thing.
In gender, but not in sexuality.
Yeah, we're all three of us are cisgender, right?
So you just proved my point for me. It comes back to sexuality.
No, it
That's
doesn't.
not proving your point.
So what did Bish say? What did Bish say his sexuality was?
How did that prove your point?
Because you just told me it wasn't about sexuality, and you brought it right back to sexuality.
Your gender identity is not your sexuality, because we are all cisgender, correct? So we were all assigned male at birth, and we identify as men. So we're cisgender, which means that we're not transgender. So that is different than who we're attracted to. It's not.
I follow you. I follow.
Okay.
So sexuality and gender are not the same thing, then. Like Bish and I just talked about that we're both men, but we both are attracted to different people.
Yep.
That's not the same thing. Okay. Who you were
Right.
attracted to was not your sense of identity.
and none of it's a choice.
Yes.
You know, you don't choose to be trans. You don't choose to be gay. This specific talk about trans kids. Kids don't choose to be trans. A trans kid just is a trans kid, just like you and I are cis kids when we were kids. You know what I mean?
Yeah, but I mean, we thought we were a million different things when we were kids. What if it's just a fun phase for them? And then
Imagination is different
you know
than
what I mean?
right. Imagination is different than human development. Okay, so we can distinguish those two things. So when kids, like in fourth grade or something, like start to experience attraction for other people, that's not imagination. That's an emerging property of their development.
I just think it's a big decision for.
It's not a decision. We keep saying that. I don't know why. I don't know why you keep using that word.
Because it is a decision for parents to let their kids or not let their kids intake in that role until they're older.
It's not a role. It's just how they experience themselves.
Okay, well,
inside.
it's a big decision for a parent to let their child express themselves at that young of an age.
It's not a big decision.
It really is, because if the child
did you decide to allow your child to express themselves as a girl or boy?
Absolutely.
In what ways?
However they want, but they're not going to dress as
in what
brother until
ways,
they're grown and out of the house.
In what ways and how are they big?
What do you mean? They're boys and they're girls. They do boy and girl stuff.
So it's not a big thing.
And you also said however they want, but then you put limitations and disclaimers on that. So it's not however.
No, I put disclaimers and limitations on what decisions I would make as an adult regarding my child.
This is not about you. Okay, that's the thing. It's not about you. You're
but
saying
it is, because whatever you do as a parent and they do as a child reflects on you. So if I allow them to make bad decisions, it reflects on me as a parent.
It's not a bad decision being who they are. What's a bad decision is not supporting your child in being who they are. That's a bad decision.
So, Vanilla, I do family therapy. So when I work with families, there's a very interesting standard that I do, which is in terms of, like, for example, experiential family therapy. Big words, stupid things sometimes. But what it is it's allowing parents and kids in the family units to be able to integrate their emotions together across the family structure. The emphasis I place in that family, especially through learned skills, is to validate feelings, but not validate behaviors, especially if they are either bad, dangerous, or disruptive of the family. Okay? Mm-hmm. So when we're talking about children who have a developmental arc about their sense of self, which is internal, all you need to do is validation. There are no big decisions to be had. The only big decision would be if there's specific medical care involved.
I mean, everybody, to each their, I'm not, like I said, I'm not hating on nobody. I'm not hating on nobody's beliefs, their thoughts. You know what I mean?
It's not a belief.
It's
not a belief. It's not a decision.
I'm not talking about orientation here. I'm talking about everything in general. Whatever people choose to be, choose to do, whatever people are. I'll say it that way. Whatever people are. I'm not against anything anybody is. How about
Gender
that?
is an orientation.
Is that more fair? I'm not against anything anybody is. How about that?
Well, I think you're being a little dishonest there because you already said that you are, because you said that you're going to not allow someone to wear a dress because of how.
No, I said I wouldn't allow. I did that. Well, because I said I wouldn't allow my son to wear a dress in middle school doesn't mean that I'm against anything that somebody is.
Clearly does.
As a parent, that I'm not letting him make a decision that might harm him in the future if he decides to change his mind because he is still a child and doesn't know how to make that mature decision for himself.
What harms a child is a parent who does not support their child. A child wearing a dress, is that so triggering and upsetting? Because why are you concerned about the child wearing a dress? What is that fabric hurting?
The fabric is hurting the outlook of everybody around him and the outlook of how you're going to be judged as a family.
Okay, so you're making it about you and not about your child.
No.
Yes,
nothing's about me. It's about
It's about what people might say about your family, not about you supporting your child.
So, Vanilla, if you're worried about how other children or even adults view your child, are you indirectly or directly supporting the other people?
I'm not indirectly or directly supporting or unsupporting anybody. I'm protecting my child.
But you're not. Would you rather be a shield against those people than just simply worry about what they think?
Or do you want to be the people that are not supporting. You're on one side or the other. You're on the team of helping your child or on the team of hurting your child.
Well, I believe that letting your child make that decision for themselves at that age is hurting.
To wear a dress?
Yes. If your son is in middle school and you allow him to wear a dress to school, I believe that you are hurting him.
How? How is that fabric hurting
Because
you?
he is still an immature human.
Your child wants to wear the dress, though.
It doesn't matter. But they're not mature enough to make that decision.
Not mature enough for the fabric.
Vanilla, if you're saying your child is immature to wear a dress, are the other children...
I love your hair, by the way. That looks fabulous.
Are the other children who are potentially saying mean things to that child, are they mature or are they immature?
Well, they're all immature. That's because they're children.
Okay. So why not support your immature child anyways? What are you losing?
Hold on, baby. What you're losing by supporting your immature child is the maturity in yourself. You have to be an adult and be a parent and say this is or this is not good for you.
You already said that you were worried about your own reputation and not about your
No.
You did.
Now you're putting words in my mouth.
Actually, Vanilla, and I'm going to say it one more time, and I hope you process this, and I'm not being like a smartass, I'm being very serious. This is not about you.
Nobody said it was about me. I said this is about me being the parent and not letting my child make a decision that might hurt them in the future.
So what is your view on parents who support their children if they have to transition?
If they hum to that's a whole different
So, for
ball.
example,
if you're letting your child go all the way to transition before they're 18 or 19 or moved out and on their own, that's fucked.
Is it?
Why
Am
is
I
it fucked?
fucked?
It is. That's fucked.
Why?
Well, because then you're bringing sexuality into it.
It's
and
not
It is. It clearly is. If you're letting a 14-year-old boy become a 14-year-old girl, that is completely
Vanilla, do me a
about
favor.
sexuality.
Vanilla, do me a favor,
100,000%. There's no way
What
around
kind
it.
of sexuality is that?
Yeah, what is the sexuality?
There's no way around it.
What's the sexuality? Which is it?
What's the sexuality of that child who transitions?
You just let a little boy that has a penis at 15
you answer
years
the
old
question,
become a
please?
little girl with a vagina at 15
Can you
years
answer the
old.
question, please? Also,
I just did,
also-
literally.
You did
Nobody
not.
said anything about letting them have vaginas. Nobody said that.
So,
And also,
hold on.
please stop talking about children's genitalia. It's really creepy. It's weird.
Yeah. So
You just brought
the,
it up. You just said if you let your children change their gender, what do you mean? I brought it up and that's creepy. That's
changing their
literally
gender?
what you just asked me.
No.
Dude.
Vanilla.
What?
Changing their gender is not a sexuality.
It literally is.
Vanilla. So when
This
I
is
work
why we need
with,
education, kids.
So are
When
you
I-
talking about just changing their clothes or are you talking about changing their parts as a human?
So I'm going to give you the whole spectrum, okay?
Because as a human,
Vanilla,
that would be into the spectrum that you're asking me not to speak
Vanilla, hold on. I want to show you something.
to. I like the way you
So
say my
when-
name.
I'm sorry. Are you attracted to the way I said your name?
What, baby? Hold on just a minute, y'all. I gotta help one of my kids on the toilet, as a matter of fact.
You can help one of your kids now? Wow. That's cool.
Oh, wow.
That's a
Yeah.
weird comment.
I mean, I helped my kid and you said it was disgusting or fucked or whatever it was.
Well, I mean, if you let your kid change their gender, how old is your kid?
She didn't change her gender.
Oh, well, that's what I said would be fucked. So if you're just letting your kid express herself, that's cool. That's cool. But what I was saying is fucked is if a full transition goes. You know what I mean?
There is no full transition. That's the thing. You don't know what you're talking about.
There is a full transition. If you go from being a boy to being a girl, that's a full transition.
No. There are transgender people who don't have bottom surgery, never have bottom surgery, and don't want bottom surgery, and they're still
Well,
trans.
that's not trans, that's gay.
Oh my god.
I'm sorry. What?
Transgender is when you change your gender. It's literally in the word transgender.
Trans is trans is a
Holy
prefix.
shit. Hey, y'all
So,
have a good
vanilla.
day, man.
Okay.
So Vanilla, I know you're still there listening because that's what you do. Vanilla, I want to teach you 2 words that you're going to be very familiar with in the future, okay? With your kids. No contact. And you're going to wonder why. But the words are no contact, and you're going to wonder what happened. Think of this moment. This is why.
So I talk about this often, right? About how parents only care about their own reputation and not about their children's mental health and well-being. And he literally admitted it, right? Like, that's what a lot of parents are. That's why they want their kids to be 18, because then they can put all of this on their kid and say, I have nothing to do with them being trans. That was all them.
Yeah, that was wild. Stay in school, kids.
I'm I'm trying to figure out like the fact that he said that if you're just a boy who feels like a girl that you're gay.
Yeah,
Like that,
like what?
what?
Literally know how that works.
That's which is gay is a sexuality. So like, what is he talking about? But then if you
He had no
transition,
understanding of
yeah, I
any-
know. So yeah,
And as a kid who's potty training, and it scares me. Like people should be educating themselves on these things. Like before your children become, if you don't even know what the sexualities are, how did you even get to adulthood? I don't know.
No, and also we're not having kids get bottom surgery just willy-nilly.
Uh,
I'm doing anything willy nilly, but I don't know if willy was a good word to use there. Sorry.
You know,
bro, vanilla was willy nilly.
Yeah, bro. Yeah,
bro.
Bro.
Hey y'all.
Hi.
So I'm pro-trans. Like, I don't have any type of problem. I wanted to come on and just like have a good conversation because I am 21 years old. I'm a 21-year-old woman, but I transitioned to male medically at 17 years old, and I detransitioned at 20, and I started identifying as trans, I think at around 14, 15. And then I went through therapy, the whole like standard of care, and then started hormones at 17, and then I ended up detransitioning now back into a woman at 20. And I guess my sort of question, I think Erin is a therapist. So I was just curious about what your opinions are on the way that the standards of care are and what we can do to better avoid outcomes like mine. Because in my day-to-day life, now I do struggle with, for example, like you're hearing my voice, I have like an Adam's apple, and there are things that I do struggle with now because I medically transitioned, and I was diagnosed with gender dysphoria so many times. They told me, I was always being told by my therapist, like when I was trans, or like, this is who you are, this is your truth. And we're also happy that you're who you are, that you're living your truth and you're being you. And at the time that it really did feel that way for me, like that is genuinely how it felt for me. And it was all very real and very like, it was all very real to me. And so I was just very confused. And I think I still am in some ways confused by that because I don't know. I think it's like being told that my trans self was my true, real identity. And now that I'm living as a woman again and I'm going through all of the trials, and this is my third time going through puberty. And now this is my true self. You know what I mean? So I'm just curious as to, coming from your point of view as a professional, like as a therapist, what are your opinions on things that we can do to better avoid outcomes like mine so that other kids like me, because I was a trans kid, how can we avoid people like me regretting that into the future?
Well, there's no way to avoid regret because there's always risks of things not working out in our favor. That's the first thing. And the second thing is there is a standard of care for those who detransition, and just simply it's continued care and support thereafter. But beyond those two statements I made, I can't offer anything significant because I have no idea what your case is or what things look like for you. So you're better off getting that continued care somewhere else.
Where else?
You'd have to figure that out. I don't know where you live or what your working situation is or anything like that.
So,
It just
because I
depends.
feel like
You have to reach out to someone within your area. Like my presence here in a TikTok is not going to help with that.
Okay. I don't know. I'm not asking for like your to therapize me or like give me your advice. I was just curious if you had like any point of views on that, because I feel like for me, I have tried to reach out and like look for therapy, And I think that that response is a little bit disappointing, because you can't, because it was there. I had a clinical psychologist who she was in charge, and a psychiatrist and a endocrinologist who were in charge of handling my situation. They were the ones. I was 15 years old when I was diagnosed with gender dysphoria. And I think they are the ones who helped me get to where I am now. And I don't know, I just feel a little bit disappointed that the solution now that I'm in the situation that I'm in now is, well, just figure it out. You need to figure it out. I don't know, that's a little disappointing.
I didn't say that. I said you'd have to go find someone to help you continue that care afterwards. I can't help you from here. And I don't really have opinions. I just have facts about what the standards of care are. That's it. Okay. So.
And it's like, in your opinion, for the standards of care that we have, is there anything that you think like could be different, or do you think that just more research needs to come out, and maybe even more stories like mine and people kind of talking about that, this other side of transition that isn't really talked about that much, to kind of give us a clearer picture for how we can change the standard of care, for how we can update it and make it better and make it safer?
Couldn't tell you, honestly.
You don't know?
That's for other clinicians in different situations to decide. I don't have any opinions on it.
Okay.
Yeah, I'm not in a position to write recommendations for policy changes within certain healthcare modalities.
So for people like me, for women like me, who kind of go through life now in this very interesting state. I'm 21 years old. I'm trying to go back to school, and I'm trying to do a lot of different things. And for me, I think that my professional life is being hindered a lot because of it. Mainly, my main thing is with like my voice, I think, because testosterone, like it's a very powerful thing. I started it when I was still a minor when I took it. And I think for me, what I feel, my mental health, like professionals who were dealing with my case, I feel let down in the way that when I was going in for therapy, I was bringing up all of these other things that I had that were wrong with me. Like, I had a very low self-esteem growing up. I had a very incongruent sense of self, and I really struggled with personal identity. And I feel like when I went to my psychologist and my psychiatrist and I explained the situation to them, it's almost as if none of those other things were really relevant. And it all kind of, as soon as I mentioned the gender incongruence, that became the main focus. And that focus then shifted on, okay, so let's talk through it so that we can get you your letter, so that we can get you to start testosterone. And in my letter, my psychologist wrote that there were no other mental health issues that were contributing to my decision to transition, which I think is a little bit dishonest. Because now at 20 years old, I had to do that digging.
Did you get a consent form? Did you have an assent form that told you all those things?
Like the informed consent?
Yeah.
Yeah, since I was under the age of 18, so me and my mom both had to sign it. I live in the state of Florida. It was like back and front, in total 4 pages. It was like 2 pages stapled together. And I did sign that because at the time I really wanted to do it.
How long ago was this?
This was in 2019.
Right. I don't know if things have changed now, but the assent,
no, they've always been really intense in Florida.
The assent form that my child had to sign for hormones was 10 pages.
Oh, wow.
And both parents had to sign. And it does actually say on here that the child does not suffer from psychiatric comorbidity that interferes with the diagnosis, workup, or treatment.
Yeah, that's what they, like, my psychologist also wrote the same thing in my referral letter.
That's not what they're right. That's something that needs to be, like, confirmed.
Examined, yeah.
Yeah, that's what my psychologist confirmed.
But did you know at the time that did you feel at the time that wasn't the case for you?
I was still really young, so for me, like, my mind was set on transition. So even if it was kind of brought up to my attention that maybe, which I don't think it's in the standard of care, I don't think you're allowed as a mental health professional to try to be like, well, why do you feel that way? Because that
Actually,
might
that is
teeter along the
standard.
line of conversion therapy. I've heard.
No, that is actually the standard.
Okay.
Yeah.
Because the difference between conversion therapy and me asking, like, what are you feeling and how did you get here? There's no explicit action up from my end to change you. It's just to help explore what it is you're experiencing. That's not conversion of any sense of the word.
Okay. Yeah, because I
So-
feel like,
Because I feel what I recognize too, like there's got to be some more information about your case that I don't know about, and perhaps you can just get another professional to look at your entire case and see where the gaps are. Because I don't know your case, and so I wouldn't be able to give you any sort of opinions that would delay any concerns. You'd have to go do a bit more work to find what you're looking for.
This is interesting to me because the assent form that my child has and the patient education form that we have is by the Endocrine Society.
Yep.
yeah, so was mine. I went to an endocrinologist.
access- My child has access gender affirming care in 2 states, and we had to redo this form when she started on a new endocrinologist. And it's the same form, even in 2 different states.
Yeah, I signed, it was, for me, from what I remember, it was, again, I think it was about like 2 pieces of paper back and front, and it went over like testosterone it will lower your voice, it will give you facial hair, it might affect fertility. It just went over like all of the things that testosterone will do to me. I think I actually have pictures on my Instagram because when I was signing the papers, I like posted pictures on Instagram because I was super excited. So I have like pictures of the papers that I signed before I had my first shot administered at the hospital. It was a pediatric, I think a children's hospital in like the next city over from where I live, they specialized in like gender affirming care.
You can always have a case manager look over your case notes and have it like referred over to another clinician of some kind. So it's just, there's a lot of things you can do, but it just will take extra steps. And my opinion isn't going to change that need.
Yeah, because unfortunately, you sound like you are in the 1% of kids who start the gender affirming care process and it doesn't work for them.
I actually have a mutual of mine who he's trans and he actually studies people like me. He studies detransition academically, and the numbers based off of the most current studies, it's actually anywhere from I think 5 to 10%
The
of
latest
people
one I
end up
heard from last
transitioning.
month, there was a study done in Australia, and it showed the 1% again, and that has been pretty consistent. So I don't know what study that if you have a source for that.
Yeah, and even then, like I'm not opposed to that. I know that detransition is a relatively rare phenomenon. I'm aware of that, and I know that like people who transition, because in my experience, while it is upsetting, I'm also not against logic, and logic shows us that transition is beneficial and that it does help people. So I can't, in good faith, be against that because I'm aware that there are people who really do benefit from transition. I think for me, it's just disappointing that I've gone to different people and I've tried to seek help and I've tried to get resources for my situation, and I've been turned away for people who the general answer is we just don't know what to do with you.
Are you still in Florida?
I am, yeah.
That sounds like that could play a part in
Yeah,
that.
that was what I was going to say. It sounds like the experience you're having is just based on the state either curbing standards or not giving enough resources for agencies to help you. So this seems like a localized issue more so than anything.
I have like other friends. Like I have one friend I think who's up in Washington who's also kind of dealing with the same issue, where I think that there's just not a lot of knowledge because it's like what you said. Only 1% of people do it. It's not that many people who do it, but ultimately that leads to people like me kind of just being really lost and not really knowing what direction to take because it's very easy to sort of just, I don't know, be like, well, it doesn't really happen to anyone, so there's not really a need to do more research onto it or try to come up with something to maybe help or set us up on a pathway. I had to figure out my detransition all by myself because no medical professional, no mental health professional was able to help me. And I just hope that in the future, there will be more resources for people like me, and there will be just more understanding that it is something that can happen. And I didn't come up here to argue. I support kids transitioning. I support anyone transitioning. I have genuinely no problem with it. I think it was more so just, I was just curious about, I don't know, like the panel's opinion on people like me and people who end up like me.
Well, it's not fair to you for me to have an opinion about you. So, especially when I don't work in opinions, first of all, but even if I did, it wouldn't be fair if I had no other information about you. So that's why.
Well, not even about me, but just about detransition in general.
Well, each person's detransition is very unique. So it's really hard to generalize. And that could be not an issue of policy per se, but just the competency of clinicians who don't understand that there is no general consensus about what detransition is because it's about very unique circumstances.
Right. And like Aaron was saying, like looking into your case would probably be the place to start to see if you were getting the proper care that because it doesn't sound like it, right? Like, and I don't know, like, again, I have not seen the consent forms before 2022. So I don't know if they changed from 2 pages to 5 pages or 10 pages, but my daughter's was literally 10 pages.
Do they vary from state to state? I don't know.
Not, it's by the Endocrine Society.
Oh, okay. Then it shouldn't.
It shouldn't.
I'm sorry, guess. What's your name? I don't know how to pronounce your name.
Nehama.
Beautiful name, my God.
Thank you so much.
You're very welcome. And now because as you know from what's going on in the country as far as all the laws and everything that happens, I hate to ask this question because it's a position of privilege, but do you have a possibility to look for assistance anywhere outside of Florida? Because I don't know if Florida's going to give you the help that you need right now.
Yeah, unfortunately, right now I don't.
And that breaks my heart to hear. I mean, it's such a horrible thing that we even have to ask people that. Like, hey, can you leave your state to go somewhere that might help you? And that's heartbreaking because no one here is invalidating your experience. I'm very, we're not going to say that your experience is wrong because it's not. But it's just a matter of I wish there were resources. But Florida, I think you can probably agree, is not going to have that resource for you. God, it's heartbreaking.
Yeah, would never always, as I talk about in this live all the time, we advocate for individualized, proper healthcare for transgender youth, not for any steps to be skipped, not for anything to be rushed, not to have any type of proper care. Not saying that your whole team didn't follow things the way they should have.
One of the biggest gaps in transgender healthcare is not so much the general or primary care itself, but it's aftercare. That's where we see most of the issues in the data.
I agree.
So it's possible that you're just kind of experiencing that gap right now. And your state could be the big influencer on that, but I can't really tell you.
I'm in one of the only blue counties in the entire state. Florida's a massive state, and I actually am thankful that I live in one. I think out of all the counties, there's only 3 that are blue, and I'm in one of those. Right. So it's a pretty progressive area that I'm in. We're kind of like in our own bubble. For me, the way that my care went, it was at 15 years old. I started to feel feelings of gender dysphoria. So my mom, she went and she found me a gender affirming psychologist who, she had been practicing for years. She speaks on several panels. I think she is in some way, she's like a professional in the area for gender affirming care, working with gender diverse populations and trans populations. She has done panels, she has written papers, peer reviewed papers about transition, children transitioning. So this is like her thing, is dealing with children who deal with gender dysphoria. And for me, and again, she's the clinical psychologist who specializes in gender affirming care. So that's why my mom picked her out. She didn't want to go with just anyone who didn't really know what they were doing. So she spent a lot of time looking for this specific person. And even in my conversations with her, she is very knowledgeable about gender affirming care. And I think I did about 2 to 3 years of therapy, of gender affirming therapy with her before she wrote my letter. And I went to go to the endocrinologist's office to get my first shot. So from what the standards of care are, because I have read up on them, all of the standards were met. I think it's just a matter of lack of follow-up. And I think issues within the model itself, I feel like there are some issues with the affirming care model that do need a little bit of tweaking, because no system is perfect. And I think that the model that we had before, we had a lot higher rates of children who were suffering long-term. But I do think that the affirming care model does also have its issues. And I think people like me are kind of slipping through the cracks of that because nobody has followed up with me. I haven't had a single person from my team follow up with me. I haven't had anyone from the hospital reach out. I haven't had my psychologist reach out. I haven't had anyone reach out to me to do follow-up. So I do agree that there is no follow-up happening. There is no type of follow-up.
WPATH actually recommends for follow-up, so it seems like perhaps they just aren't following those standards for aftercare.
Did you continue therapy after you got on testosterone though?
Yeah, after testosterone, I continued seeing her for a couple of years, yeah.
So what, I'm just trying to follow your timeline. You said you were 15 and then you saw the therapist for 2 to 3 years. Wouldn't that put you like really close to adulthood?
I was 15 when I started identifying as trans, and then 15, so about 2 years. And then I started testosterone at 17 in 2019.
Okay.
And then I continued to see her up until I think around summertime of 2022, I think maybe, or like early into 2023, something like that.
What is your age again? You said
I'm 21 years old now.
You're in the range. I don't know if they're going to be able to help, but have you tried contacting the Trevor Project? I'm thinking they are a resource for LGBTQ plus youth specifically. I don't know if they're going to have specifically what you're looking for, but you know, the fact that you're approaching this is something like, look, I'm looking for assistance. I'm not getting. Maybe there's an organization they can connect you with nationally that might be able to have more information than what you're going to get locally.
It could. I can always try. I mean, I don't know. We'll see.
It sounds like you tried everything, so I'm just trying to brainstorm what else we can do to help you. Because like, there's nothing really Aaron can do, you know, just from his perspective. I'm just trying to think if there are resources that might be available I can't think of, that something you haven't tried yet to reach out.
I guess it's mainly just my hope for the future is that, you know, we can expand those resources.
Yeah, me too.
Using the information that we know from how transition helps kids. Because I feel like me going backwards, it's kind of like I'm going through the same thing all over again, just in a different way. It's kind of funny. So I'm familiar and, you know, I have the reins on it because I've done it before. I can do it again. But I just do hope that in the future we can get like resources and stuff for people like me so that, because I don't want anyone to have to go through what I've been going through. It's really hard. I've been having a really hard time. Detransitioning for me has been much harder than my first transition. It has been very difficult mentally, having to tell my family because I was a huge advocate for myself. I was really fiery and passionate about my trans identity. And I think the shame and guilt of having to go back to my family and, you know, kind of get the I told you so's and all that, like it's very difficult. And I hope that mental health professionals in the future, as we start to see more people kind of end up like me, not many, but a few, I hope that we can have resources to kind of help people like me in the future get over that shame and then give us kind of like a sense of direction for where to go after all of this. using what we know now about trans care, which is so important. I think it's super important to keep research going.
Yeah, and I do wonder if it's just lack of resources because of the state you're in. Even though it's a blue state, Florida is very overall just blue county. Even though Florida's kind of anti-trans all over right now, and a lot of people are trying to go outside of the states to get care, especially when it comes to like the youth bans, which is causing the care to not be as good as it should be, even for transgender youth right now. Because there are so many there's so many people trying to go to transgender sanctuary states to get care that they don't have enough resources to help everybody right now. So, I wouldn't advocate for not having better resources or, absolutely not. So you should be able to receive better care than what you're getting.
Thank you. Well, that's all I really have to say. I just wanted to pop in and kind of get like different opinions on things and kind of see. But again, like let kids do whatever makes them happy. Let people transition if it makes them happy. Transition care is a very valid form of healthcare, and trans rights always, of course. And I hope that we can all come together to, when the dust settles for some of us, and we find that this isn't maybe what we want, that we can have resources for women like me and for people like me to live happier and better lives and move on from all of this. So yeah, thank you guys so much.
I'm not a counselor. I'm not a therapist. I'm just a confident bitch, and I can tell you whatever gave you your confidence and your strength whenever you felt you were trans. Find whatever does that now for you in your identity, because you're still the same person. You are still the same person you were then. So the confident bitch that you were then is still there.
That's very true.
So tap into that. And I can't tell you what you feel as far as shame. I can't tell you what to feel. That's not my business. But what I can tell you is never lose sight of the person that was inside you, because that person is still there, and find them again.
Very true. Thank you.
You're welcome.
Absolutely agreed.
Well, thank you guys. Have a great night.
Thank you. Yeah, that's not the results we want from gender affirming care.
No,
it does happen. And it never said that it doesn't happen.
And they are perfectly valid.
Yeah, it's completely valid. It's very let's go point out an observation. Interesting, maybe is the word. How compassionate people in the chat became when they're just as passionate about invalidating other people. Because none of us on the panel were invalidating their experience at all. We're talking honestly from from a position of knowledge, from what we have, from what we can say, but maybe have the same compassion for everyone that we were able to show someone else, because everyone should always be compassionate of other people, unless they're assholes, and then I'll troll you right back. But there we go.
Yeah, like people want me to provide some opinion, especially when I have none. Like I can't provide you with one.
Right.
So, yeah.
Yeah. Besides for just them deserving, continued care. I mean, what else can we really?
Yeah.
Do,
And people don't realize I also have to be thorough about like protecting my licensure, not giving advice that would potentially hurt someone.
Right.
So,
of course.
So.
And even she, and I think what a lot of people in the chat missed also was that even she, when she was in here, was not invalidating trans people.
Right.
Like, listen to the whole thing. She's like, "Hey, I'm asking what kind of assistance can I get? What ideas you have?" And having a genuine conversation, and at the same time saying, "Hey, but also, trans children should be able to be trans." And I think that part got missed by everyone that was jumping to attack.
They don't want to hear that part. They don't want to hear that part. They want to use her experience to hurt other trans kids when she wasn't even using her own experience to do that.
No, she's not.
And it's also not fair to her for me to render any advice. Like, I don't know her story well enough. Of course.
Yeah, I did like your advice, though, of having the story, looked into, like her case.
Right. Just which is, something I can't do from here. Like, that's not fair to her.
Yeah, Aaron, I need you to review my case and tell me what to do next.
Sure, Calcifer. No, I'm just kidding.
That's funny. Hello.
What up? What up? What up, everybody?
How old are you?
I'm 35.
Cool. Go ahead.
Yeah, I have a question. My
Uh-huh.
question is, I am very interested in the topic here, but I wanted to know, is the LGBT or the trans community or people that follow those ways, is it a natural action?
Yes.
Yep.
And what are you basing it off?
The natural occurrence of gender incongruence, or just essentially a variation in gender development for humans, especially for kids.
Okay, let me give you an example, right?
That's a weird pivot.
Let, let me give you an example as to where I'm coming from so I can be much clearer,
All right.
right?
Okay.
So in nature, we would use the animal kingdom as a kind of basis or foundation, right? To validate human actions.
Not
So,
like gender, though. It's not an animal thing. It's a human thing.
well, when you say gender, gender would come under, I'm from the Bahamas, by the way.
Okay.
Would gender come under a natural type of occurrence? What I mean to say is the action of it, because you have to be taught the gender ways, right?
Nope.
For example, I want to compare racism with the gender topic here. So
Not
why
comparable.
why say you have to be taught, right? Because I have a lot of friends from all over the world who is from very different culture. So if you have a so-called white kid and a so-called black kid from very young, if you set them together, no form of racism at all would ever occur between the two. They would be literally ignorant of that action only because in the comparison what I'm using, love is a more natural human action, right? So the racism part of it would have to be taught going in from a childhood or so on and so forward. Same thing as like with the trans kids, because if you
So
maybe sort of.
yeah,
well, if you
Razzie,
give me a minute just so
no,
I
hold
can
on, Razzie.
conclude
Hold on. Before you conclude, did you hear my first initial response when you asked the other question?
about it being natural.
Yeah, and I said yes, right?
Yes, and I asked on what foundation are you basing it
Yes,
being natural
and it's
off? It
based-
has to.
And it's the basis for this is the development of gender in a person. It doesn't require social or linguistic concepts or contexts. People still develop a sense of self. Sometimes it's incongruence, and even though they have no language for it or any cultural experiences for it.
So you're
It's
telling
very
me
rare, and it happens, and it even happens beyond or outside of culture.
so when you say gender, right? So I can understand much clearer, right? Is it an action of intimacy or
No.
It's a sense of self.
It's a sense of self. It's not an action, it's an emerging property of the person. All
okay?
humans
So
experience this, and it's not a specific action a person takes.
so take a young girl or a young boy
Mhm.
for an example, right? Who just came out of the mother's womb, right? How would they then come into that relevance of
So
them being, them not being what they were actually born as?
So
What they
gender
actually came.
is so hang on one second. So gender is formed in utero. So when you're still being developed within the 9 month of pregnancy, that forms. But when between the ages of 3 to 7, gender develops. So between 3 to 7, we know which gender we are, like even if we don't have the words to say it. That's why I knew that at age 6, I knew that I was a girl, even though I was born male.
How did you come up with that conclusion? Is what I
I
mean
didn't
to say.
come up with that. It's something
Yeah, so
innate.
the sciences of endocrinology, neurology, and psychology came up with that as a conclusion because they studied it extensively. And
Okay, so
they ruled out social influences, especially at the ages of 4 to 7.
it sounds very similar, and forgive my ignorance in comparing it like this, but it sounds very similar to the Jungle Book story or the Tarzan movie, because if
That would be
I
socialization. We're not talking about that.
no, let me clarify myself, right? If I, at the age of 2 or 3 or 4 years old, just decide or feel, just because of my environment, that I want to
It's
now
not a
live.
feeling. It's not a
Right.
feeling, and it's not because of the environment.
Right. So what we're saying
When you say
is
it's not
that
a,
when we're
if it's
saying
not a feeling, if it's not a
Razzie,
feeling,
Razzie, when we're saying that the environment doesn't influence these outcomes, we're saying that the Jungle Book doesn't happen in that specific instance.
so you're telling me,
Gender development is not a product of the Jungle Book, for example. It's not the product of environmental factors, because that's what the book is about. We're talking about the very basic understanding of brain development in this case, not of environmental development.
so is it possible in the same such cases for a young child to want to become an animal or want to transition themselves to a dog, a cat, a horse, whatever the animal may be, they choose.
No,
If they
No.
feel,
Gender identity.
no, because that's not the human experience. We're
Yeah.
talking about the human experience right now.
Right. And so
when you say human
what's happening?
experience,
Hold on, Razzie, hold on. When we're talking about the fact of a child identifying with a group of animals versus their own sense of self, there's a huge difference there in which there is an identity about out-group or in-group messages within their environment. When we're talking about the development of the brain, especially the parts of gender identity, that is not part of that process. That is a very internal process. Because when a child, for example, in the Jungle Book, is identifying with the tribe or whatever group of animals they're with, that is about the out and in-group experiences, the relationship they have to those other entities. When we're talking about gender identity, that is just a relationship to yourself, and that's it.
okay, well, I understand the point which you're bringing, but I still don't think I am being clear from the perspective I am trying to show here, because when we talk about the comparison with the Jungle Book or Tarzan, I really meant to say that, well, hey, anything, even animals, anything has to be taught that has life in it. Now, why I say it has to be taught? Because this is the basis and the fundamentals of humanity. This is where we get this. Oh, give me a chance. This is how we even get the so-called research that we have to our disposal for gender, so on, so forward. This is how we get the historic evidence, because it was taught somewhere down the line. So, for example, I'm an African, right? I was born an African, but the historic evidence and records have it very clear where it was a time in my history where I was
Yeah.
beaten not to recognize myself as an African. So it now
Razzie,
brings in term that I don't even have a last name right now. So
Razzie, is the identity of an African an out and in, or sorry, an out and in group identity, or is that an internal identity of yourself?
well, it's a thing that I cannot change, even if I wanted to be.
That's not what I'm asking you. Is that an out group identity or an internal identity?
Well, it's an internal. Anything that you can't change would be internal.
So,
So
no,
why don't
it
you
would be an
think?
out group identity because you belong to the group of other Africans, right?
Well, because I'm actually a product of that. You
Right.
understand? So
That's
now
still an out
if I
group. Right. That's
so
an out
now
group.
yeah, so now
It's not an
in
internal
comparison,
one that you've developed on your own. That's always in relation to a group.
okay, so now in what you say we're grouping. So in the comparison of the gender, I would
That's
be a product
internal.
of I would be a product of my mom and my dad to the grouping of a
No.
boy child.
No. That's not how that works.
When you
Because
say
let's
no,
say, for example, you have a mom and a dad, a trans daughter would not be the in group of either of those parents,
when you say a trans daughter, what do you mean?
meaning a male child who identifies as a girl internally.
AKA me.
Okay, let me get this straight. If right now I choose what's the difference of me choosing to identify as a camel as opposed to me
I don't mind
as
answering
opposed
this.
just give me a chance just give
No,
me a
I
chance
did
as
give you
opposed
a
to
chance.
me
Hang on.
identifying as a
Hang on.
female.
I let you talk. It's now my
What's
turn. Hang
what's the
on.
difference?
Hang on. Hang on. One moment. So it's not a choice. It's not a feeling. It's just who you are. And also, were you taught to be a boy? Were you taught that you were a boy, or did you just know that you were a boy?
No, I was taught in the ways that a boy should be, seeing that it
But
my
Those are
my
my
birth
question.
records validate me
Hang
as a
on.
male.
That wasn't answering my question. I'm gonna hold you to my question. Were you taught to be a boy, or did you know that you were a boy?
Well, I was taught to be a boy.
Okay,
Do you mind
We
if do you mind if I answer this and kind of build on your response, Calcifer?
go for it.
Yeah. Okay. So when you say that you were taught to be a boy, this is where the difference between your identity comes into play versus being a member of some outgroup. There are gendered norms that make you a member of an outgroup, of being, quote, masculine or acceptable as a boy. But that's different than your internal sense of self.
Well, when I say I was taught to be a boy, you may have just automatically assumed that my mom and my dad and my family structure taught me how to be a boy. That's very incorrect. Who taught me how to, or what taught me how to be a boy is actually the system that I live in, that on planet Earth.
Which
Everywhere
still
that
is
I
about
go,
outgroup experiences. Because you're
everywhere.
talking about shoulds, which is about expressions and norms, and you see them everywhere, but those are about memberships of outgroups, not about your internal
No,
sense of self.
no. What I mean to say is, when I say society taught me how that I am a boy and how to become a boy, a man, right? Is
Uh-huh.
when I look around in all of my class and all of my from a little preschool toddler, they said that anyone that has a shaft hanging down between their leg must go to the opposite side of the bathroom.
Which is membership of an outgroup, not your identity
Well,
of self, Razzie.
when you say identity of
So
self,
Razzie, I appreciate that perhaps we have a language barrier or some sort of diction barrier, but you keep answering, or rather, you keep pointing out why these things are out groups and they are not reflective of your internal sense of self because you're using external sources the whole time.
well, when you say external sources, I'm using me, you,
No,
everyone that actually is in
you are not an
existence.
you are not an external source. You are an internal source.
When I say I'm using myself and yourself and everyone that actually is in existence, is when I look at myself, the reason I can't compare myself to a camel, or I would know that I have probably a mental problem there, is because when I look at every camel around, I see very distinguished traits. I see 4 legs, 2 humps, so on and so forth. And that's how we distinguish when you go into the jungle. Only one way you would be able to distinguish a zebra from a lion,
Right.
from a
So you're talking about
hippopotamus.
speciation, but you're also talking about the way you should be, which is about norms, which are rather about the outgroups that we are experiencing ourselves as.
So
you're
how
not
do
talking
you?
about you're not talking about your internal sense of self. You're just talking about the way in which you relate to those outgroups.
So
That's
what is
different.
the only way? What would be the only way for anyone to identify a dog?
So we have schemas that identify certain speciation traits. But we don't identify the dog internal sense of self because we just don't know.
No, we don't. You know, you going on to imaginations. I asked a straightforward question. What
I'm sorry,
would be
what did
the?
I just say was imagination?
Let me rephrase my question. Right, in a functioning society, if you walk in a neighborhood that is very strange to you, and you see dogs, cats, horses, pigs, so on and so forth, would you ever look at a pig and say it's a dog or a cat?
Can I just ask a question real
we
fast?
have
I'm sorry.
schemas,
I've been
man, so
quiet.
Sorry, go right ahead.
It's a really easy one that I asked like 10 minutes ago. Animals aren't gender identities. Why are we having this conversation?
No,
a camel is not a gender identity. A dog is not a gender identity.
No, I'm trying to understand how we identify. How do we identify? Why would I see a man that looks like a male, have the same components as a male, and want to call him, which is a male, a dog or a female?
Okay,
He has
I'm not entering
nothing.
the animal conversation anymore.
Yeah, that's speciation, Razzie. That's not. Do you know what I mean by speciation?
No, what I'm telling, I don't think you understand what I'm saying.
Razzie, answer my question, please. Do you understand what I mean by speciation?
Yes.
Then what does it mean?
You are trying to bring forward that speciesization would be grouping. For example, the animal kingdom, the human kingdom, so on and so forward. But I'm not meaning in that sense. What I'm meaning is exactly how would I identify you as a female if you look like a male? It's the same comparison of.
Do I look like a girl? Do I look like a woman?
Pardon?
Do I look like a woman to you? Am I a woman to you?
Well, you look like a female, but it still does not change the fact that what you are.
Yeah,
How would I be?
Hang on. I identify as a male. Yes, that never changes. However, I at the same time am a woman, am a girl.
Or you may be an actor. Maybe a better. You may be an actor. ACTOR.
Hang on. Can we please get off the animal subject? Because again, we established that animals are not
No, I didn't say anything about animals. I said you might be an actor.
I wasn't an otter. How is
No, I say an actor. An actor.
Actor, not an otter. Yeah.
Yes, because you are putting on a costume.
Oh,
That-
Jesus.
Bro, this is getting so...
Are you a male?
So...
Are you a male?
So, like I mentioned earlier, if you were listening, I identify as a male, yes, but also at the same time, I identify as a woman and a girl.
How do you validate yourself as identifying as a woman?
Because my my innate sense of self, my innate, consistent, persistent, insistent, innate sense of self tells me that I am, and also I move throughout life as a girl, as a woman.
Okay, so it brings that quest that it brings that back to what I was saying. You said that you identify as a male. If you identify as a male or a non-male, regardless what you identify as, that's why I originally asked the question about natural or nature. Nature proves whether I like it, whether you like it or not. Nature proves where you are a male. By nature, you is a male. So if you identify, hold on, give me a minute. If you identify,
No. You took like an hour. You keep going on. The steamroller is not available tonight. Honestly,
I have a point.
please.
You understand that there are some species, like some animal species, that like they can change their sex, right? So that's natural. That's natural in other species. So why can't? So I'm still identifying as my sex at birth that was given to me at birth as a male, but I'm saying that I move throughout life as a woman. So
as an actor.
it's not natural.
What the hell,
natural,
dude?
it's natural. It's found in nature. It's found in the world in other species.
So, in other words, what Calcifer is saying, Razzie, is that a trans person's circumstance of having an identity different from their sex is a natural occurrence because it occurs in the brain. They're not an actor.
Anything that's natural, would it be a complement to life itself, to the sustenance of life itself?
Because life is about one thing, which is variation. And trans people are on that spectrum of variation, including, and guess what? All humans are on variation. So variation is very much a human thing. It's also a natural thing.
Okay, I want to use a hypothetical question, right?
Tell me something Jungle Book again.
I really don't know if
it's not. This is a hypothetical question, right? And the hypothetical question that I'm posing here, right, is we see all the movies and all the series and everything that they're coming out with, for example, the Fallout Shelter, right? So if we was living in a dystopian type of world like that, right? And
this is going.
And
well, we've gone from
let's say
Jungle Book to Fallout.
Yeah. Right.
Yeah. Well, let's say there is a
still a woman. Just gonna.
Let's say there is.
Exactly.
Let's say there is a detriment. Let's say there's a detriment to the human species where we are on the verge of extinct, right? And we have a group of trans women, a group of trans
they
men.
Can't reproduce. Oh no.
A group of. No, we're talking about. No, don't cut me, because we're talking about the sustenance of life, nature.
A million times.
Yeah. Like.
Here.
Thank you.
Those of you asking what more important things, what am I using in my hair? This is the Dyson Airwrap with the curling brush attachment.
Love it.
I can't believe it that like a person doesn't understand that a trans woman who didn't get surgery would still have the appendages to reproduce, and so would a trans male. They would still reproduce.
They still still do. Many trans people have children.
Yeah.
Calcifer, can I ask you a personal question?
Hold up.
Uh-oh.
What's up? Fish. What's up?
Are your parents cisgender or transgender?
Unfortunately, cis.
Crazy, because I thought like there were transgender people making more transgender people according to that logic. That was happening by nature because all you're seeing is transgender people in your family making you transgender, but I guess not.
I mean, if my parents were transgender, then they'd be accepting and I'd be talking to them.
Oops,
so
There's that part.
I'm sorry.
All good.
Oh my god, I'm so sorry. We went from Jungle Book to Fallout.
Speaking of Fallout, I've only seen the first episode.
Is that like Netflix?
No, Amazon. Or no, was it Amazon Prime?
Amazon Prime, yeah.
God. Okay, so everyone, all the guests in the box waiting to join, we've already covered Disney Plus and Amazon Prime. So your references next time will be Netflix or Hulu only, please.
You know, everyone's watching like the Fallout series, but I've been sort of glazing over like
I haven't even started that.
Yeah, I haven't either. I've been watching The Idea of You. That's been my interest of late. Such a good movie.
Wait, someone said there's a trans person in Fallout? Okay.
I'm pretty sure, yeah.
I've only seen the first episode, so I don't know yet.
I don't watch much TV at all.
I gotta
Paramount Plus.
I gotta bring my trash bins down, you know, since my husband's not here.
Oh, is that what you're calling the kids now? Lovely. Wow. You hear what Mel called her kids? Everyone in the comments get angry.
I did not call my children
Aw.
trash bins.
Mama's little trash bins.
Let's get some L Mels in the chat.
Right? L trash
You
bin.
hear my daughter laughing over here?
Oh my god, she's a trash bin. I love hearing a trash bin chuckle.
Did you hear that? Loves hearing a trash bin chuckle. Yeah, and those of you that keep trying to get me with this whole like gotcha, like, well, Mel has 2 trans kids, so like that's impossible.
Apparently.
Oh my god, the teenage shade.
Yeah, I
Mel
mean,
has 2 trans kids. Like, so what?
it's,
Hey,
It doesn't change your life.
I'm a vegan trash bin, so give me all the vegan food.
Jake in the comments, Jake, you can identify as that, but I'm going to identify you as silent right now. Okay, so shh.
identify you as silent. I love that.
Yeah.
All right, I don't know what time it is. Anybody know?
It's getting late. It's 8:19 Central, so it's probably 7:19 your time.
9:19 Eastern.
8:18 Central.
Wow, I'm a minute ahead of you, Calcifer.
It's one of those weird time zones.
My microwave gave the wrong time, clearly.
Oh, yeah.
That makes sense. Yeah, so probably, I don't know. I'll probably be back. I gotta go do that and walk my dog before it gets completely dark outside. So.
Thanks for letting me on, Mel.
And I dyed my hair, which is what I needed to do. So,
Bruh. What's up, bruh?
guys, thanks for hanging out.
Bruh, it's so wavy, bruh.
I know, bruh. Look at that. Look at that
Surf
fucking
on the
hair,
waves,
bruh. Bruh, the
You know
hair.
that it
hair,
doesn't look red. Like, it is red. But it doesn't look red.
It's a tiny bit red on the camera.
Mine naturally gets red in the summer, like when the
Does it
sun
look-
gets on it.
You
Oh, yeah. You got some red in your roots. It shows.
It does.
It's there.
Yeah.
Anyway, okay.
We're like Mel's little stylist crew. Bro, look at the roots in her wave,
Yeah.
bro.
Yeah, look at that red,
You
bruh.
know, I missed the Aaron Bish bro time, honestly.
Right? Me too.
Me too, bro.
Been like a
Yeah,
year.
It's been a year, bro.
Like a year, bruh. Yeah.
What the fuck?
Whole fucking year, bruh.
Bish, what's happened to me, bro?
I don't know, bruh.
Fuck.
Yeah.
I feel like we're like a different version of Beavis and Butthead.
Right.
Like I'm like this like high pitched voice, like bruh, and then Bish is like
thanks,
bruh.
I've been saving my testosterone for 50 years to do that.
Hey, bruh. Yeah. Yeah, bruh.
Love it, Bish.
I'll see if I can drag Sherry back on with me after. So,
Bro,
got
Sherry.
shit to do.
I'm gonna see my husband, bruh.
Ooh,
What?
Hasbro.
Oh, let's all go check our hate comments. I'm going to say we each got 6 at least.
Okay, all right. I might have got more as the host.
Yay!
Like 8, but
Yeah, I kind of watched the comments, and people were mad that I didn't give that other guest advice, and I'm like, that's not the right place or time for it.
Also, apparently, I give bad points. What? And also, standard talking points. Like, the fuck?
One more time,
Yeah,
that guest is still here. Completely lovely guest. I really. Sometimes it's a conversation, you know, like we're not expecting, but it still was a good conversation.
you know what? Ugh, I almost called you Bush. Boone.
Wow.
Boom. I was going to talk to Boom. I was trying to combine your names, I think.
Oh, it's Boom Bro.
We could raid Parker. Parker could probably take about 20 to 30 minutes of you. So go ahead. I don't even know if he'll notice with the 500 of you. You know, that's
Are you saying that Boom and I would make a bush? Is that what you're saying?
Bush Bro.
That sounds inappropriate.
Bush Bro.
That's okay. Bye. Bye, everybody.
Yeah, bye, bro.
Good to see you.
Yeah, bye.
Bye.